Welcome to the Neurofaith Podcast. I'm your host, Dr. Kirk Thompson, and we are here to explore what it means to live at the intersection of emerging scientific discoveries about the mind and following and being formed by Jesus, and how that can lead us into a world of greater human flourishing. The title for this, our first season, is Thinking Well During a Pandemic. We're eager to hear from our guests not only about the work they are doing, but how it speaks to what it means for us to thrive in our present particular moment. Today, it is my pleasure to have as guest Aderonke Pederson. She comes to us from Boston, where Dr. Pederson is a treating psychiatrist at the Massachusetts General Hospital and is a faculty member at the Harvard Medical School. She has recently come to Boston from Chicago, where she has done training and her medical education at Northwestern University. And we are here today to talk about Dr. Pederson's experience with what it means for us to approach mental health from the position of how we address stigma in minority communities, how we address race and religion, a number of other things. But in particular, I'm just really eager for you all to have the opportunity to hear Dr. Pederson's own voice speak about what it's like for her to do her work with joy and gladness in a field that is not always easy to do that in. And so it is, again, my pleasure to introduce Dr. Aderonke Pederson. Dr. Pederson, welcome to the podcast.
Thank you so much for the opportunity to be here with you. And I really look forward to our conversation today, because this is a vitally important topic.
So let me begin by, as I always do, I love to invite our guests to tell our listeners what it really has been that drew you into the field, and what were some personal things about your life and your life development that found you where you happen to be at this point in time.
I think we all, at some point in our lives, whether as younger people or older people, we're always asking that question of, why am I here? What is my purpose? And as Christians, Lord, what do you have for me? And I think in that journey and in that question of, how will God use me vocationally? In my community, in society, I was drawn to the idea of approaching caring for people holistically and caring for people in a way that I'm not just asking them about their physical needs. I'm not just asking them about their biological needs. I'm also asking them about their psychosocial is a term we use in the field, psychosocial needs. I'm also asking them about their spiritual needs, and to say that as human beings, we're not just biological, we're not just physical entities. There's something about our makeup that is so intelligent in design, that there's so many parts of us. So I was drawn to psychiatry and to mental health care because I thought, as a vocation, if we want to call it maybe my version of tent making, right? But even more so, can we marry the two together, be a tent maker and also a carer of souls? And I think in medicine, psychiatry allows us to care for people in this very holistic way. And certainly people practice psychiatry very differently. Some people feel like I'm biologically oriented, so I really just focus on medications. Other people feel that they're mostly just focused on, say, psychotherapy modalities. But I think for me, as a Christian, as a believer, I think I do bring my whole self to the table. And while I would never impose my beliefs on any of my patients, I do allow them to also bring to the table their whole selves in terms of how they approach their mental health care and wellness.
Mm-hmm. We live in a culture that can sometimes tend to silo things, as you rightly pointed out. In our field, we can have people who practice psychotherapy, people who practice biological psychiatry, these different things. Your capacity to become this person who encompasses, we might call it even, you become multilingual in that you are bringing together multiple different domains of life and ways of thinking about the human condition, not least of which being your place and person as a follower of Jesus. I would love to hear, first of all, I would love to hear you talk a little bit about what that has been like, what the work has involved for you personally to kind of hold those things together. And then I'd also like to go on to address what you've witnessed that patients have discovered when they discover that, oh, here's a person who actually can speak multiple languages and not just one or just the other.
That's a great question. And I think it's certainly an art form and a work in progress, right? In terms of how to, provide people a space in which, traditionally in medicine, we've said things like, I'm the heart doctor, I'm the lung doctor, I'm the kidney doctor. And, if a patient who approaches a kidney doctor starts discussing, their lung issues, the kidney doctor might say, well, I have to refer you to the pulmonologist because that's not my area of expertise. And certainly we're trained across the board, right, in terms of the way medical training works. There's kind of this foundational piece to our training. However, I think the art form is this idea that in order to be effective in any area of the body, you have to have an appreciation for the body as a whole and how there's the interconnectedness. We see that, say, in things like cancer care, where there is a lot of research that has been done around the role of faith and belief and hopefulness and positive outlooks on healing the body in a physical way. So I think that's certainly the case when we're talking about things like depression and anxiety and mood disorders. So certainly I think I'm still in a process of learning, and I think it's about lifelong learning in medicine. How do we create spaces where we continue to modify those spaces so that people feel welcomed and seen? And I think that's what a lot of my patients say to me who come to me, and they appreciate this fact that, you're not asking me to just present to you one aspect of who I am as a person. You're giving me the room to come to you, fully as I am. And one of the things they say to me is, I just don't feel heard. And they could be talking about their psychiatrist, they could be talking about their therapist, they could be talking about, their cardiologist. I just don't feel heard. I just don't feel seen. And certainly for patients who come from communities that have been underserved or disadvantaged, communities of color, Black patients, Latina, Latinx patients also have that experience in to sometimes a disproportionate degree because of the intersections of some of the social factors that people face. So, I think it's really important that patients feel that they can be fully heard and seen, because at the end of the day, we depend on their report of symptoms. And when they don't feel like they can trust us, or they feel like we're only partially listening to them, we might miss certain symptoms that could help in terms of the recommendations we're giving for treatment.
Mm-hmm. You know, Aderonke, as you're speaking, I mean, it's been striking to listen to you weave language of the body and language of the soul and language of the mind, language of the ethnicity and language of other things all together. And even in this conversation that we're having, I'm thinking, dang, I would want you to be my psychiatrist, because I'm talking to somebody who, even here in this conversation, I sense your the effort that you're putting into sensing others. You're saying, but you're not just sensing in one domain. You are really listening for. If I'm hearing you right, your work as a psychiatrist is listening for multiple different threads of their experience as a human being, in ways that perhaps other physicians don't, and certainly in ways in which we don't have that experience in much of our lives together. And I'm also hearing that on your part that's not just like falling out of bed. I mean, that takes work, that takes effort to bring together in your own mind all these multiple different threads that are coming together that a person themselves may not even be that aware of, that they are bringing to the table. I'm wondering, you've articulated this tapestry of different features and forms of a person, of what represents a person, from their spirituality to their ethnicity, to their medical condition, to their physical complaints, the complaints of their heart and their soul. One of the things that we would say, obviously, that has been much more in the public consciousness in the last several years has been the way in which we are kind of coming to terms with how uh, dominant culture in this country has behaved toward minority communities. And I'm wondering, in particular, what have you seen, and particularly given your interest in caring for those who have not been seen as effectively, how have you seen mental health and mental health stigma emerging, showing up in minority communities? And would love to hear your thoughts about what you've seen, but also what your vision is for how would be best for us to respond to that.
So I'll start with your question on stigma in the Black community in particular, which is where my area of research is in, through research funded by the National Institute of Health. In terms of stigma and stigmatization of mental illness, certainly that is not unique to any one racial community, or any one group of people. Stigma towards mental illness is quite universal within the United States, globally, and there are many reasons for that. And I think even within our religious communities, in our Christian community, I think it's more recent that we have sort of worked towards wrestling with these issues. In the last 4 to 5 years, we've had conversations around lead pastors and senior pastors who have completed suicide, and what that means for us as a Christian community. I think this idea that once you give your life to Christ, once you become a believer and follower of Jesus, that you should just be incandescently happy,
Mm,
right?
mm, mm,
And
mm, mm. Preach.
and you have nothing to worry about. And I think the problem with that is, if it were the case that salvation brought perfection, then we would have no need for God after we said, the sinner's prayer, quote unquote. And we would, in some ways, then take the place of God ourselves, because we can produce and sort of package this happiness that God gives us, and whip it out anytime we need, like a wand. But I think God certainly calls us to this idea, within the realm of our faith, of that you are saved, that you are being saved, and that you will be saved. And so it's not a one and done, kind of thing. And within this, in this side of, eternity, on the side of eternity, that there is a process that's happening not just in our spiritual selves, but in our physical bodies. And when our heart is broken, for lack of a better way to describe that, right? When we have coronary artery disease or whatnot, when our limbs are broken, it's very easy for us to say, okay, I need to get help for that right away. I'm not just going to pray about it. But when our brains are broken in one way or the other, this organic material, right,
Mm-hmm,
in
mm-hmm.
our heads, when that's broken in one way or the other, I think we're so quick sometimes to say, well, that's because you're not praying hard enough. That's because you don't have enough faith. What did you do wrong? And within the Black community, those are conversations I have with focus group members and some of the research I do. This question of, is taking medication a sign of lack of faith in God? In one of our surveys, over 50% of the participants said, sometimes, very frequently, or always, yes, this is a sign of lack of faith in God.
Wow.
Some people, like 2/3 of the sample, said things like, mental illness might be caused by sin, or mental illness might be caused by possession by evil spirits. You're
Hmm.
letting a spirit around you, and you need to get rid of that spirit. And I think the reason why it's sort of duplicitous is because we are able to unify the idea that when my limbs are broken, I go to the hospital, I get help, I get it repaired, and I can pray about it too. I can still call my pastor on the phone and pray about it. And that praying about it doesn't preclude getting help from a hospital system, and a hospital system doesn't preclude praying about it, and that these things can go together. So I think with mental health care, we've been sort of slow to adopt that idea. And in terms of the question of some of the conversations we've been having over the last couple of years, I think what's unique to communities that have been historically and contemporarily disadvantaged, like the Black community, like Native Americans, like the Latinx, Latino community in this country, the unique aspect of that is that there's societal structures that were put in place to say, if as a Black person, you are having, say, a psychotic episode or a manic episode, you are seen very differently than your counterpart who's white. And then gender plays into that. We've done studies upon studies that show that Black people in this country are viewed as aggressive, as lazy, as unintelligent. While those are heartbreaking things to say, it's important that we know that and we wrestle with that, because, and I've said this before, I think in offline conversations with you, that we as Christians are supposed to be the best equipped to understand the impact of oppression on others, and to have that empathy to be able to say, I might be feeling okay about my status in society, say as a white person. However, if my brothers and sisters, my community, which we should consider ourselves, right, not just communities based on race, if my brothers and sisters are suffering, then that matters to me too. It's not just their problem. So certainly mental health care is a space in which we see disparities across racial groups, but mental health care is also a space in which we see opportunities that are missed around what we're talking about here, the unification of body and soul, in a way where we're not putting them in tension with each other, but saying God gave us a body for a reason. And while, yes, we're fallible and we're fallen and he saves us, but he doesn't desire for us to sort of neglect and misuse our bodies. We are his temple after all.
What's interesting is you are describing something that is casting a vision for me, in which, as I hear you talk, I hear you talk with a redemptive voice, in which, as you are describing simultaneously the fracture lines culturally, the fracture lines racially, that those fracture lines in some respects have a resonance with the fracture lines that we have within ourselves, in which we divide my spirit, my soul, my spiritual life from my physical life. And if I'm hearing you right, the work, especially as those of us who are people of faith, who are called in particular to be people of reconciliation, that as we are doing that work of reconciliation along cultural and racial lines, that it also creates the opportunity for us to resonantly create reconciliation for people within their own divided hearts of, like, I've got this spiritual self and I've got this physical self, and never shall the two meet to each other. And I'm hearing you describe a setting in which working for reconciliation in one area actually draws forth the possibility of reconciliation, for our bodies and our souls being brought together as a whole unit, even as we read about in the scriptures. I'm wondering if you could give an example of anything or something that you, in your work, in your research work, or in the work that you're doing clinically, in which you've seen ways in which the work that you do, and in particular as a person of faith, the work that you do, how has that, where have there been opportunities for creating interventions or for creating opportunities for healing and regeneration along these lines? And more so, would love to hear in general from you how going forward, we who are people of faith can play a role in this conversation that has these two, this macro part of it, that's where things are fractured in terms of, social and racial and cultural lines, and then this micro portion where between my body and my soul are split off from each other. And I'm wondering if there are things that you're doing right now that where you would say, here's an example of what happens when we do the kind of work that I really like to do, and we see new life starts to emerge.
Yeah, that's wow, what a great question. And we always should be getting there, right? So what do we do with all of this? I'll give two examples or two scenarios briefly. One is a patient, that I see in a community clinic program. And when this patient first came in, and this is a situation that is not uncommon. So while I'm describing this one patient scenario, there's certainly multiple situations that arise that are similar to it. But patient came in to see their general primary care physician, and was having some psychosocial difficulties, was having scored high on some of our depression screening questionnaires, and had never seen a therapist or a psychiatrist before, and was very hesitant at the idea of seeing a mental health provider. And in that process, because the patient was a Black woman, and because her provider was also a Black woman, she had a little more openness, to talk to her about some of her hesitations. Well, I don't want someone who's just going to push medications on me. I don't want someone who's going to, just label me, in one way or the other. And what does this label mean, for me in the community? I don't want to have to share this with my pastor or with my, church members, things like that. And so she had all of these hesitations, but because of the cultural sensitivity, the cultural competency, that the Black provider had, they were able to, navigate some of these questions enough to have me come in for at least a brief introduction with the patient to, talk about, this is who I am. And she said, is it okay if we talk about spiritual things because I'm a Christian? And I said, absolutely, it's completely fine. And yes, this is not a Christian organization that we're in. And there's nothing on the door that says, declares us, a faith-based, center or anything like that. But in our, first couple meetings, we were able to talk through trauma that she had experienced. We were able to talk through deep-seated loneliness that she struggles with every day. And this woman loves Jesus, is so committed to her faith, and just feels, she says, well, it's okay that I suffer on this end because I won't suffer on the other end. And I think it was novel for her to hear this idea that while, yes, God redeems our suffering and our pain, that he also has joy for us in the midst of this, side of eternity. So at the end of one of our sessions, she said, is it okay if we pray at the end of sessions? And, we held hands, we prayed together. And, I think that sometimes when we, let's even say professionals in the secular spaces that we exist in, come across this idea that, we can bring ourselves fully to the table, I think that sometimes there's fears or hesitations and how people might view that. But I think if we're saying that there's just one me. There's not a me that's a Christian and a me that's a psychiatrist. There's a
Right.
me that is
Right.
both of those things. And that, I know what it means to go beyond the boundaries of my profession, but engaging with someone as a human being and allowing them to bring their full selves to the table meant that I was able to do things with this patient that has dramatically impacted her psychological well-being.
Wow.
And so I think that's one example, certainly of being able to say, again, I'm not these two different people. And I hope that it's encouraging, to Christians out there to, not see their professional world as completely separate from who they are and what they bring to the table as believers. And then in terms of things we can do, more practically, I think there are a number of things we can do. I think one of them is educating ourselves about some of these issues. I think that in many ways, there's information overload
My goodness.
on social media, on the internet, so much information out there. But I do think that it's important that we're educating ourselves. And by educating ourselves, I don't just mean, going and looking at history facts, which I think is important to look at, but I also mean in scripture, we see Jesus going around and caring for people's souls, but also caring for their bodies, caring whether they have food to eat, whether they're hungry, caring whether they're sick physically, caring whether they're being assaulted by society because they were caught in the act of adultery, right? Caring about them in those very vulnerable moments. And I think while sometimes we can get exhausted, there's sort of like empathy fatigue, right? I just want to move on with my life and focus on more quote unquote spiritual things. I think that there's nothing more spiritual than what Jesus tells us. If you give a cup of cold water to the least of these, you're giving that to me. And so I think approaching our faith in a way where we're not thinking, well, I'm learning the disciplines of my faith in this corner here, and I'm thinking about social issues in this corner here, but that they're one and the same thing if we're approaching it correctly.
Dr. Peters, I don't just find in you someone who is providing our listeners with information. I would long for our listeners to imagine that they wouldn't just want to hear the information that you are offering and to apply that information, but I would long for our listeners to imagine them becoming the kind of person that you are becoming. And this notion of how you have taken your work as a psychiatrist and that you are doing the hard work of bringing integration together with that. Your spiritual life is not something separate from the work that you do, and you have an imagination and a way of visioning the world and your life and your interaction with people that is so powerfully holistic. And I was just that example that you gave of the African American woman patient that you worked with. I thought of like the ways in which her imagination had been kept more limited, but that in interacting with another daughter of God who was enabling that woman's imagination to expand beyond her horizons, because Jesus was at the center of what you were doing, but being at the center includes everything else that you're also doing. And so I just want to thank you again so much for the work that you do. Harvard has no idea of their good fortune in inviting you to be part of their clinical and faculty environment. And it has been my deep pleasure and the good pleasure of the listeners of the Neurofaith podcast to have you be a guest on this episode today. I look forward, perhaps if we can, to more conversation with you down the line. Again, for our listeners, this is Dr. Aderonke Pederson, faculty member at Harvard University Medical School, treating psychiatrist at Mass General Hospital. Dr. Pederson, thank you so much for joining us today.
Thank you so much for having me. It's been a pleasure.